So today we will be showing you a case of robotic surgery, radical prostatectomy for a 65-year-old gentleman who has localized prostate cancer which is confined to the prostate itself. He was detected with an elevated PSA of 7.5 when he presented to us for certain urinary problems, and then the MRI did show a suspicious lesion on the right side, and following that a biopsy confirmed the presence of prostate cancer. His PSMA PET scan didn't show the spread of cancer anywhere outside the prostate, and he was counseled regarding multiple options like surgery or radiation, and he had a history of lung cancer which was operated successfully, so he thought, let me get this cancer out as well, and he decided to go ahead with surgery. So after the patient is induced with anesthesia, a general anesthetic is required. He's positioned using the stirrups and using the head rest as well as shoulder pads to make sure he doesn't move too much during the surgery. He's strapped into position and all pressure points are softly and carefully padded to make sure there are no complications from the position itself. I then proceed to scrub up, and then first step involves painting the area which is required for surgery and isolating it from the rest of the body. We put in a urinary catheter, and then we will start insufflating the abdomen with carbon dioxide gas through a small needle which is known as the Veress needle. Once the abdomen is insufflated, that means the abdominal wall comes up. We are able to then put in our ports, and the first port we put in is the camera port, and subsequently all the other ports we use the camera to guide us, and generally we keep 3 more robotic ports. And 1 assistant port, so a total of 5 ports are used during this surgery. Once my ports are inserted, we get in the robot to dock. Docking is the term used where the robotic arms are then attached to the ports and the instruments are placed in through the arms, and that means that the robot is now connected and the instruments are in working order within the patient's abdomen. So this is done serially and with close guidance of our camera to make sure the instruments go appropriately and not just blindly, so that they don't injure any other organs. Once the robot is docked and everything is set, I will move to the console and then begin the surgery there. So the console is connected to the robot at the patient's side through a number of wires, and so the movements that I make at the joystick at the console are transmitted into the robotic instruments, and that's why I'm in complete control of those instruments and I'm doing the surgery. Because this is a common misconception that it's a robot means doing it automatically, but that's not the case. It is purely the surgeon's movements which are replicated by the robotic instruments, and I am under complete control. I will have an assistant at the bedside to do small things like suctioning any fluid or blood, or putting clips on certain blood vessels, or giving me instruments or small pieces of gauze during the procedure. And the assistant is also important in changing the robotic instruments that will be used during the surgery, in cleaning the camera and keeping everything going smoothly during the case. So generally a radical prostatectomy or a robotic surgery takes about 2 hours to complete. In cases in which it is more difficult or where the tumor is come out a little bit, it may take even a longer time. And following that, we put the prostate into a bag and we are ready to retrieve it once the robot is undocked. So a small incision is made. Either we enlarge one of the ports or we take an incision lower down depending on the size of the prostate, and through that the specimen is extracted, and then we close all the port sites as well as the incision from where we remove the prostate. The patient then is woken up by the anesthesia team and he will be shifted to the recovery room where he'll be observed for an hour, hour and a half. 99.9% of our patients don't go to the ICU and they are back in the ward within an hour or two after the surgery, and after 6 hours usually we will start them on some water or clear liquid. So this is the case of a standard robotic radical prostatectomy for prostate cancer, and it is one of the most common procedures we do robotically, and in fact robotic surgery has really revolutionized radical prostatectomy, because an open surgery would take 6 hours, it would require blood transfusion quite regularly, and most men would be in the hospital for a week or two after the procedure, whereas now things are much better and they go home in a couple of days. Thank you for watching this video, and if you found it informative, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.